Hi, my name is Sarah Pavlenko and I'm a midwife at the Family Birth Centre, and this is my student midwife Carly. Today we're going to be going through an abdominal palpation, and I will be teaching Carly how to perform an abdominal palpation on a pregnant patient. So Carly, you've been through the PowerPoint presentation.
I have.
And have you seen the video on how to perform a palpation? Good. And you've also been through our clinical guidelines.
Yes.
Fantastic. Do you have any questions about the abdominal palpation?
No, I don't.
No? Great. Okay, we'll get started. Okay, Carly, so this is the equipment that we need when we're performing an abdominal palpation. So we have our hand gel because we always gel our hands before and after a procedure. We also have a non-stretch measuring tape. One side has centimetres on it and the other side has inches, so that we can't cheat when we're doing our measurement. Okay. Now, we also have a Doppler to listen into the fetal heart, and we use our aqueous gel with that. We also have the wedge here, and that's so that we can insert it underneath the patient's hip so that they're not laying on their major arteries and cutting off blood flow to the baby. Okay, good. Okay, so let's get started. So here we have Emma, and Emma is 39 weeks pregnant. Okay, so Emma, do you mind if we perform an abdominal palpation on you today?
Yes, that's fine.
Great. Okay, so what we'll do first, if it's okay, is we're just going to lift up your gown just to expose your abdomen there. Now, have you? What we would do first, Carly, is make sure that Emma has emptied her bladder, so that obviously we're not. We can perform the palpation accurately, and it also is more comfortable for Emma. Right. Okay. So you have emptied your bladder. What we'll do is we'll grab the wedge there, Carly, and we'll just place it under her hip here. Good, okay. So she's just slightly tilted there. Okay, now what we're going to do first is inspect the abdomen. Okay, so we want to look at, first of all, the size to get an overall idea of how many weeks gestation Emma is. The next thing, and it looks like she's equal to dates, but I guess the way that we would tell is by measurement. Okay, so the next thing we want to do is look for any scars. Okay, so we would actually look down quite low as well, just to make sure there isn't a previous cesarean scar there. But there is no scars on Emma's abdomen, which is great. Okay, and scars would also indicate that there is that there might have been a previous surgery as well. Okay, the next thing we want to do is look for any hormonal changes. So you might see the line that runs up the middle of her tummy, which she has here, and this is the linea nigra, and also any stretch marks, which she doesn't have. So that's great. Okay, what we'll do now is I'm just going to gel my hands. I forgot to do that, so I'll just gel my hands, and you can gel yours too, and then we'll get started on the abdominal palpation. Now what we'll do first is we're going to start at the top of the fundus. So this is called a fundal palpation. Okay, and what I'm going to do here is just place my hands on and use the pads of my hand to gently go around and see what I can feel up here. And this is how we will determine the position of the baby. So to me it feels quite knobbly up here, like I can feel limbs, so that's good. It feels a little bit more curved around here. That could indicate that that's the bottom there. And what I'm going to do is then move down to the fundus here, and I'm going to feel along laterally. So I'm going to hold my hand on one side of the abdomen with a little bit of pressure, and then just feel down this side here, again with the pads of my hands, to see if I can feel what would feel like at that. So something that would feel nice and firm, nice and straight. And I'll just do that same on the other side there. So it actually feels like to me that the baby's back is running along this side here. So that would also indicate that our baby, if you've probably seen from the notes, is in a longitudinal position. So running straight down, so up, down mum's downwards, 18 here. Do you know what it's called if the baby was laying crossways?
Is it transverse?
Yeah, that's right. And then laying across in an oblique. Oblique, fantastic. That's very good. Okay, good. So what I'm going to do there, so I'm happy that the back's along this side. We have a bottom here and feet up here, or limbs up here. But I do want to confirm that there is a head down the bottom here. So what I'll get you to do, Emma, I'm going to use both these pads of my hands, and I'm going to put one on each side. And I'll get Emma to take a deep breath in. That's it. And breathe out slowly. And I'm just going to feel right into the pelvis there and see, yeah, that definitely feels like a head to me. It's nicely engaged. It's not moving out of the pelvis. And the way to see how much of the head is above the brim is to look at where your pelvic brim is and to feel, and then see how many centimetres of the head is above that. So I can feel that there's about still 3 centimetres, which is perfectly fine, above the pelvic brim. Okay. Any questions with that at the moment? No? Would you mind just passing me the measuring tape? Thank you. Okay, so now we're going to measure the fundal height. Okay, so the fundal height you've probably heard should equal around about the gestation or the weeks that Emma is. Okay, what I'm going to do is just find the top of the fundus there. There it is there. Place the measuring tape on, and I'm just going to tell Emma, is it okay if I just feel for your pubic bone down here? Yeah. Great. And I'm just going to feel down low for the pubic bone. So that's your pubic bone there? Yeah. Great. Okay. So if we have a look there, oh, that's perfect. We're measuring at exactly 39 weeks. That's great. Okay, great. Now we're going to listen into the fetal heart rate. So I'll get you to grab the doctor for me. Okay. Now, do you know where I would find the fetal heart rate on Emma?
Well, if the baby's back is on this side, we would like to do it on this side,
yeah,
and below the umbilicus.
Yeah, great.
Baby's head down.
Yes, perfect. Well done. Okay, so let's see if we can find it there. So you count it for a full minute. Okay, good. That's a full minute. That's great. So the heart rate then was 145. Okay, so that's great, Emma. That's a beautiful heart rate. The heart rate should be between, do you know what the heart rate should be between?
Was it 110 and 160?
Perfect. Yes, it is. Yeah. So that's very normal for your baby to be 145. Beautiful. Okay, we'll just grab a tissue and wipe Emma's abdomen there. Thank you. Right. Okay. Now, Emma, is it okay with you if Carly was to have a little go at doing the abdominal palpation? Yeah, that's fine. Fantastic. Okay. Now, Carly, before we begin, have you done any abdominal palpations before?
No, I haven't.
Okay, but you have seen some?
I've seen a few.
Yeah. Okay, great. Okay. Well, give it your best shot. And if you have any questions along the way, just tell me. But what I would like you to do is to try and teach this skill back to me. Okay?
Yeah. Okay, so we've got a wedge under Emma with exposed to her abdomen, and we're just checking the skin for any signs of scars or hormonal changes. And I can see that Emma has the linear recra.
Yeah.
Hormonal change there, but no stretch marks. So that looks all very normal. Then I would ask Emma for consent to touch her abdomen. Emma, is that okay?
Yeah, that's fine.
So initially I just want to feel the top of Emma's fundus and just see what I can feel up there, which I does feel very numbing,
Yeah.
just like you got. Yeah, feels like feelings there as well. And then I'm just going to move my hands to the sides of Emma's abdomen there, and then just run my hands down one side while putting some mild pressure on the other side. You can feel a long part down that side. So I'll do the same to this side. This side doesn't seem to have as much of the baby on it.
Yeah, great, good.
And then I just want to feel down for the baby's head. So Emma, if it's okay, you just take another big deep breath in. And then just slowly out. Feel the baby's head just above the pelvis there.
Great.
Well. Not too sure about the amount of the baby's head.
Yeah,
above,
sure,
but,
okay.
Yeah, it's moving a little bit.
Yeah, it is moving a bit.
As well.
So when you go in and feel, can you feel where the pelvic ring is in there?
Yeah, I think so.
So if you were to use your fingers, can you locate or see that there are then about 3 centimetres above the brim?
Oh yeah, I've got that.
Can you see
you feel the ring?
You can feel the brim? Great, good. So that's how you would do for the engagement.
Great. And then I'll move on to measuring.
Yes.
So I will start with the measuring tape with inches facing up, so I can't
That's
cheat.
right. Good.
And then I'm going to put it onto the top of Emma's fundus there, and measure it all the way down to the pubic bone down here. So I might just touch that little bone start bit there. Yeah. Great. And I'll just have a little look. Yeah, so I got 39.5.
Okay. Yeah, great, good.
And then I'll just have a little check the baby's heartbeat. So I'll go on this side where the baby's back is. Yeah. For a full minute.
That's right.
That's a full minute.
Beautiful.
And now sitting at about 150, which is still normal.
Yeah, that's fantastic. Very good. Okay. Now, Emma, do you have any questions about your abdominal palpation today?
No, that was
What
fine.
we found? No? Good. Oh, great. That's fantastic. Okay, beautiful. Well, you're all free to go, and we will see you in 2 weeks' time for your next appointment.
Okay, thank you. Thanks, Emma.
So, Carly, how do you feel that you went with the body with abdominal palpation? What's something positive that you feel like you achieved?
I think I correctly identified the fetal parts on the abdominal palpation, so
That's
that was really good.
Yeah, fantastic. Good. Yeah. And is there anything else that you thought that you did well?
I was able to get the Doppler onto the right place to listen to the baby's heartbeat.
That's right. Very good. Yeah, excellent. Good. Anything else?
Maybe engagement with the woman.
Yeah, that's right.
That's a
Definitely.
positive thing.
Yeah, absolutely. Yeah. Was there anything that you thought that you could have done better in the procedure?
I think my just general confidence and skill. I think if it was a difficult presentation or a difficult palpation, I think I would just need more experience and confidence.
Yeah, sure. And I think that's something that will come with time, isn't it? Yeah. Great. Well, what I thought you did well in the procedure was that when you were unsure of the engagement, you asked me for direction with that. Yeah. So I think it's a very positive thing to recognise. I do think you engaged well with the woman and let her know when the next procedure was, the next step was going to take place. I thought you did really well with that. In terms of improvement, I think it would just be about practice and just, I think the more you do, like anything, the better you're going to become at them. But I think if you're confident level is quite good already. So yeah, I think you're doing well.
Thank you.
Thank you for your time. Very good.